Hi, I'm Sharon Racusin and the host of Voices for Justice. The goal of this show is to allow social and economic justice activists give you an opportunity to get organized and connected to the important struggles happening in our community and in our state. You're not alone. Join us. Healthcare is a human right. Hello out there. I'm Sharon Racusin, the host of Voices for Justice, and with me today is Sarah Rosenstein. She's a second-year medical student at Geisel at Dartmouth and also an organizer for Students for a National Health Program. And we've got another show that you might see talking about organizing, but today we're going to talk about root causes of there are a lot of root causes. But recently I read in the Physicians for a National Health Program newsletter that comes out, a student wrote this very interesting parable. And this will give you a sense about what we're talking about. So there's a fast-flowing river and a lot of people are drowning. And everybody, all hands on deck, everybody in the area is jumping in and saving people. And they can't do this fast enough. People are coming downriver and they're drowning and people are jumping in and saving them. And suddenly one of the rescuers decides to stop and run up the bank and run upriver. And people are thinking, what the heck is going on with this person? We need him or her to save the people that are drowning. Where is this person going? And it turns out that the rescuer was going to find out what was causing all the people from getting thrown into the river and drowning.
Yeah. And
looking for the root cause of this particular crisis. And this is really what my group, the Vermont Workers Center, does a lot of. We try to figure out, we do an exercise called Roots and Leaves.
Oh.
And
I like that.
We've got a tree and we pin up leaves on the tree branches of all the things that people are fighting against, I should say, or for. For universal health care. Yep. We're fighting for a healthy planet. We're fighting for affordable child care, for affordable housing, for free university, or not to accumulate huge loans, and to have food security and to have security and
equality.
And equality, right. And when we look at all those things, it's too much. There's got to be something that's causing all of these manifestations.
Sure.
And it turns out that there's pretty much just a handful of things that are causing all of these other things to erupt in our lives. And it's really important to look at those roots, because if you don't look at the root, you won't be able to cure the disease. As Martin Luther King has said, the diagnosis of the disease, the cure, the appropriate cure is diagnosing the disease properly. That's the root.
Yeah. We call it a root cause analysis in medical school, but I like your version better because I'm a gardener, and so I do that all the time with my plants, and we should be able to do that on all social spheres as well, right? So what do you think the root causes are, Sharon, here?
No, I personally, I think in the state, there's no political will there's always talk about not enough money, but with healthcare,
Yeah, with healthcare.
we can see that we are already paying a lot of money into a black hole, essentially, when if we just paid taxes as every person in this country should do, we would actually have a cheaper way to get health care.
Yeah.
And the money, budgeting, the way that we budget for things, many times is at the behest of some other group that actually has more power.
That's what I was thinking about as far as the leaves on the trees. So you have insurance companies who are for profit, not for health. And you have pharmaceutical companies who want to make money off of their drugs. You have hospital administrators who want to keep their hospitals solvent. And so I could go on, but there's a lot of leaves there about why healthcare at this point isn't about caring for the health of people, it's about money.
And pretty much everything is about money.
Yeah.
Everything in this country is a commodity. Should people really have a menu of choices of for-profit companies to choose from when you're dealing with health? Because that's how New Hampshire sees, fully sees, giving people health insurance. I can't even put care and into this mix because it's just being able to choose who has the time to look through all of the fine print to see what you're paying for and what you're getting and how much more you'll have to pay to get better.
The time or the education or even the resources to afford a plan that's actually going to cover them. So we see a lot of these plans that actually when people sit down and go to the doctor, they realize, oh, I have insurance, but I still can't afford to be treated.
That's right.
Yeah.
Yeah. I mean, and there's, recently talk about how cancer care bankrupts people. I mean, people have to make a choice.
Yeah.
And it's not even always about the kind of treatment they might get. It might be treatment at all. Will I be able to take care of my family and take care of my health? And from what we can see, it's really becoming almost impossible. And there is no mention in any health care insurance package, I should say, that includes dental. Dental is another entire, do my teeth not belong
to your body?
In my body, right.
They do, they're really connected
They're
in
really
there well.
important.
And hopefully if you get dental care, they should stay there for life,
That's
right?
That's
just
right.
before we started filming today, I was talking to another medical student and she was saying, oh, I'm finally going to the dentist for the first time in 3 years because I haven't had the money because I don't have dental insurance through the medical school. And we had a whole conversation about how are teeth different from the rest of your body? Why can't we get dental coverage?
Right.
And teeth play a really important role in your overall health. I don't think a lot of people realize that, but you can get a lot of systemic inflammation and problems from just problems with your teeth.
Right.
And that's something that most insurance never includes. You have to buy it additionally.
And you have to go entirely to another insurance company.
Yeah.
The one that most people know is Delta Dental.
Yeah.
I have an instance. I have dental insurance right now, but I'm dropping it because it doesn't pay for me to keep it. They are dictating when I get my periodontal work. So many people have, from no fault of my own, it is a genetic issue. I must have periodontal work or my teeth will fall out.
And they're important for digestion.
Right.
I could go on and on about the importance of teeth in your health.
Right. And when I was working and had a plan, a dental plan through my company, where it's a very large group plan. Delta Dental, it started to include, just a couple of years before I retired, periodontal visit cleanings, which would not cost any more money.
Yeah.
When I retired, they took that away from me, as if it didn't matter anymore.
Yeah.
There's absolutely no logic. And it's very, it's a terrible thing that they're doing.
Yeah, I think one of the root causes is that we don't value our aging population in this country. We value youth so much, and so you get to a certain age and then you're going to lose that because we're not valuing like the beautiful wisdom that we have from our elders, and that's such a shame. I think, you know, those are the people who should get the best care because they've done caring for people throughout their whole lives and they've worked, and you know, why are we seeing people get dropped when they're older?
Right. Even Medicare, you know, has a component. 20% of your health care you have to pay for. You have to get a private, for-profit insurance. So we keep talking about for-profit. The root, if you haven't already figured it out, is capitalism.
It is. It's capitalism, Sharon.
And so in this country, where every single, everything, I'm not sure that you can think of any particular thing that is not considered a commodity.
No.
That doesn't, you know, that our country decided you should be able to make a profit, but healthcare should not be included
in capitalism and in profit.
Right.
No. All people deserve the right to live a healthy life, to pursue their dreams and what they want to do. And, you know, when people have that, health is right at the bottom of our needs, right? Without health, you can't do anything else. But what a productive society we could have if we were taking care of the health needs of our entire population.
Right.
I mean, it would just be a beautiful thing if everyone could access care and not just be struggling or fighting credit card debt just to be able to get treatment for their cancer while their partner is working to keep their insurance, if they even have it, so that they can still get their treatments. And
right. And lately in the news has been the price of insulin. People do not, you know, without insulin you're going to die. And people, the pharmaceutical companies have decided that they can charge whatever they want. And these kinds of things should not, life-saving and preventative care should not be a commodity. It's simply, you should be able, think about this. You get very sick and you need to go to the doctor. If we had universal health care, people say Medicare for all, I'm going to say universal. Everybody is in, no one is left out. Everybody can go to the doctor. You don't have to think about a copay, a premium, or a deductible. You just go to the doctor. When we were in England, my husband got bitten by something and he had a very, very bad reaction to whatever it was, not only a rash, but physically. And we went to the health service and it cost almost nothing. They didn't ask for anything. They treated him like a human being who was sick at that moment. And to dispel any myths, when the other countries, the other industrial countries that have some sort of national health plan, those people would not give it up for 1 second.
Absolutely.
They might want to make it better, but they would not say, I've had enough, I want to pay an insurance company.
When they look at what's going on here, my friends from Canada say it's just absolutely outrageous and inhumane. I had a similar experience in England. I had to have surgery actually in England on my hand, and I just remember how kind all of the providers were, because you know, we as providers are also under time constraints based on insurance companies,
Yep.
but the providers could take time with me, and I had a nurse sing me to sleep every night. I was a little kid. And I remember at the end, my parents went up and said, "How do we pay for this?" And they looked at us like,
What do you mean?
"What do you mean? I was hospitalized for 5 days. What do you mean?" If you're hospitalized for 5 days now, that could be hundreds of thousands of dollars in the United States if you're uninsured.
That's right.
And I went and had surgery. I had a nurse sing to me, and it didn't cost a penny.
Yep. Yeah, it's and that's not to say that the providers in this country are not caring, wonderful people.
Absolutely.
But under all of that is an extra stress
Yep.
for the patient, no matter how kind and caring your provider is, that how am I going to pay for this?
How am I going to pay
How
for
am I going to
this?
pay for it?
And how am I going to get my needs met in 15 minutes? That's a hard
That's
one.
right. That's right.
Yeah.
You're awesome.
Yeah, it's just beautiful to
Yeah.
think about everyone being able to have care and get their needs met,
Yep.
and then have a productive society where everyone can be covered and everybody's in, nobody's out, just
That's
like you
right.
said.
You're going to make a great doctor.
Thanks, Sharon.
Thank you. We'll see you soon.
See you soon.
Fantastic.
Yay.
Yay.